Hello everyone, I'm Dr. Richa Mithun, consultant in pulmonary and sleep medicine at Sir H.N. Reliance Foundation Hospital. I'm here to discuss today with you all on adult immunization, that is vaccine for adults, and will share some valuable insights on the same. Now, we talk very often about vaccines in children, and we are very particular also about our vaccine schedule for our kids. We all have the vaccine card and we go on as per the schedule. But the much less spoken about is vaccine for adults. Now, why is it so? Yes, the awareness is less, and also as a community, we don't really press on it. Why is it needed? Now, understand, as we grow with age, our ability to fight diseases, that is our immunity, it wanes off with age. And therefore, there are certain diseases which are preventable, something that you can prevent, for which vaccines are available. And that's why they are needed. Now, vaccines are the safest and most convenient method to prevent you from such preventable disease. Let's first talk about a very common vaccine available, that is the influenza vaccine, which fights against a very common disease which you all must be knowing about is influenza, known more commonly as flu. Now, this is the flu shot that we are talking about. First, let's answer why do you need this vaccine? Now, as I said, with age, your immunity goes down. So, why is it needed? That it will help you prevent you from getting the infection. First of all, the vaccine is very effective and prevents you from getting influenza illness, which is very common, particularly in certain seasons such as winters. Also, suppose if you get the infection also after getting the vaccine, which are known as breakthrough infections, you will have much less severe form of the disease, and the fatal outcome, the adverse effects that can happen in certain people, certain high-risk group, which we will discuss later, will be much less. And the third most important thing is it helps you in getting herd immunity also. It helps in other people who are not vaccinated for any reason. Maybe they are too young, maybe they are too old, maybe they have weak immunity system, and they are supposed not vaccinated against that disease. It will help them in not getting the disease. So the chances of getting them will be much less if you also get vaccinated. So you are helping not just you, but your loved one also, your contacts, your household contacts, and your nearby ones, which will make the likelihood of getting the disease much less. So now that was why you need it. Now, who all should get the vaccines? The answer for influenza vaccine is all the healthy adults. Anyone above 6 months or older should get their flu shot once. It's an annual injection. Once a year you get the vaccine for this disease, the flu shot. When should you get it? There are particular months that depends on the city you are living in. Now, if we talk about Mumbai, the best time is to get it anywhere between April to July, just before the winter set in. So it depends on the city you are in. 2 phases be given, April to July or October to March. So if we talk about Mumbai, the April to July is the best month to take your vaccine. 1 injection once in a year. As I said, all healthy adults should get this vaccine every year. It is particularly important for certain group of people. Pregnant women, they can also get the vaccines even if they are pregnant, even if they are postpartum, that is 2 weeks after the delivery also. Why? Because if influenza happens in such females who are pregnant, they can get infected, they can have deadly outcomes because of the disease, their child can suffer from the adverse effects of the disease. So definitely pregnant women should get influenza vaccines. Certain conditions like people who have long-standing heart disease, lung disease, kidney disease, they should get the vaccines. People who have diabetes mellitus, people who are smokers, it's very important for them to get the influenza vaccine. People who are obese, because these are the groups that suffer adverse outcomes when they are infected with influenza disease. Also, people who have cancer, people who are on long-term steroid therapy, any other kind of therapy that you are on, chemotherapy, like chemotherapy which decreases your immunity level, these groups are more at the risk of the deadly effects from the influenza disease. So definitely they should get. But again, as I said before also, all healthy adults should get their one dose each year. Now coming to the question, are these vaccines safe? Yes, they are quite safe. Yes, you can have few adverse effects like mild rash, tenderness, swelling at the site of the injection. You can get fever for 1 or 2 days. The sometimes very rare incidences is some people get allergic reaction. So that is something, if you get allergic reaction to any of the vaccines, you should definitely tell your doctor about the same. So this was about why you should take it, when you should take it, who should take it, and are these safe. Let's now move on to another vaccines which is very important, especially related to the respiratory disease, is the pneumococcal vaccine. Now this prevents you from getting pneumonia against a very common organism which is there, that is Streptococcus pneumoniae. Who should get these vaccines? Anyone above 65 years of age. 65 or older, they should get this pneumococcal vaccine. And also anyone from 19 to 64, people again who are at high risk of getting this disease. It is people who have long-standing heart disease, lung disease, kidney disease, liver disease, people who have cancer, people who have who are on chemotherapy, any long-term steroid therapy. People, again, very important is getting vaccinated in groups of smokers, obese people, people who have diabetes, people who take alcohol daily. These groups are also at a very high risk of getting pneumococcal disease. They are at risk of getting invasive form of pneumococcal disease. What exactly is invasive form? When the disease spread in your blood also and can affect various organs of your body, and it causes various adverse outcomes. So these vaccines are actually 70-75% effective against the prevention of this invasive form of the disease. So it prevents you from getting hospitalized because of the disease, prevents you from the death because of the disease, prevents you from major adverse effects such as that effects on your heart. So they are very effective and should be taken for the certain group of people. Now we also have shingles vaccine in India. It is recommended for anyone above 50 years of age. Whether you have had shingles before or not, you should take it. There are 2 doses, very easy to take. All these vaccines are intramuscular. You just give in the muscle as per your doctor's advice. 2 doses which are given 2 to 6 months apart. Anyone above 50 years should take it. Then also anyone below 50 years who have any kind of disease which weakens the immune system, as I said before, they should also take this shingle vaccines. So these are the 3 major vaccines that we should be aware about. And so next time when you meet your doctor, ask about which of the vaccines are recommended for you. Anytime you get the health checkup, do ask for the vaccination also, because as it is very important for kids, it's equally important for the adults to get vaccinated, not just for you, for prevention of some of the very preventable disease in your community also.